Is how can we get people moving, help them build their skills, but still make it enjoyable?
Welcome to Kuul Conversations, where I, Clare McSweeney, founder of Kuul Play, sit down with thought leaders, innovators, and change makers that are shaping children's physical activity, sport, and the future of our kids' health. And at the end, we'll see how they are positively impacting kids' activity habits and learn the valuable takeaways that can help us all, coaches, parents, teachers, and communities, unlock the potential of our kids through fun, movement, and play. Today, I sit down with Graham Melstrand. Graham is the Executive Vice President of Community Health and Wellness at the American Council on Exercise, where he is responsible for developing and managing opportunities and relationships that advance public policy positions and industry standards to support us all to live healthy and active lifestyles. With the mission of getting people moving, Graham shares the path that the American Council on Exercise are paving in supporting us all to lead active lives. A veteran leader in the fitness and health industry, he also serves on numerous advisory boards and committees, such as the Physical Activity Alliance and the Special Olympics Fitness Advisory Council, that are collectively working towards a more active future for us all. Here's our conversation with Graham's powerful message. Graham, welcome to the Kuul Play community. I'm really thrilled to have you join this conversation and to really talk with you about the things that we both care about, which is helping people and kids build sustainable, healthy activity habits through movement. Welcome.
Well, thank you so much for having me.
Delighted. I'm excited for this conversation. So how about this? Right off the bat, I know your involvement in physical activity, fitness, the health industry is extensive. And so for our community and our listeners, just quickly, could you give us some background on your training and all your expertise, please?
Sure. Well, I'm Graham Melstrand. I'm the Executive Vice President of Community Health and Wellness for the American Council on Exercise. And like a lot of individuals in the space, I started out as an athlete and became a physical educator, specifically in athletic training. And worked in clinical and athletic settings coming out of college, and then moved to the commercial side of the fitness industry. And then about 23 years ago, I had the opportunity to come to ACE to return to the education and the credentialing side of things. And I've served in a number of different roles here since I came on board.
That's amazing. What a career. It's obvious that you live and breathe physical activity. And I'm curious, you referred to as an athlete, your background, that's something that you developed early as a child, or was it later in life that you acquired the skills and habits in the sports space?
No, through the start of high school, I was a little bit of a chubby kid. I didn't play sports. We were a very active outdoor family, camping and backpacking and
Right.
things, but not in the sports space. And at the start of high school, I discovered competitive road and track cycling and moved pretty quickly up through the ranks as a junior, and was fortunate enough to be able to go to the 84 and 88 Olympic trials. And then when my career ended a little bit abruptly, related to some chronic injuries, I made the full transition into this space. But I didn't know what I really wanted to be when I grew up, and it was through one of those experiences with some of the national team camps at the Olympic Training Center that I discovered that there were careers to be had in exercise science and sports medicine, and never looked back.
That's amazing. And it sounds like your family was active and they played a role in the transmission of those physical activity beliefs and behaviors, even though it wasn't in very structured or organized sport at an early age.
That's correct. And in the schools that I went to in California growing up, we did have we did have daily physical activity, which of course is extraordinarily unusual now, at least in the United States. And it was a little bit mixed bag in terms of those experiences. Sometimes it was about developing the movement skills and learning about health and physical activity, and sometimes was with a PE teacher that was primarily measured on their wins and losses on the court or on the field.
It's really amazing. That's my background as well. My family was very supportive of activity, and I got involved in more structured sport. But it's that early childhood phase that you talk about, the caregivers, whether that's even in school, whether it's a PE teacher or parents, when they support, that they give is to children's attitudes and beliefs, is really linked to sports participation. And I actually read a very interesting study recently. It was done in 2021, I believe, and it showed that like family cultures and the social background, including schools, really shapes kids. So at age 9, if it's nurtured, it appears to shape children at age 15 and their involvement in sport. And so, this variable that we're talking about, the role of even parents in shaping kids, beliefs and attitudes. Where would you want to start a conversation with, somebody who's a caregiver, a parent, even an educator, essentially any adult that contributes to the caretaking role of children's physical activity, where they just want to do the best for their kid or that kid who's
Sure.
starting out? Where would you start that
Sure.
conversation?
Well, maybe I'd start just a little bit higher altitude in terms of kind of how ACE fits into this and why we're focused on this at this point. So we're a U.S. based not for profit, and our primary focus has been the education, training, and certification of exercise professionals and health coaches. So we have these 90,000 professionals plus that are out there that try and bring our mission to the consumers, which is to get people moving. And at ACE, while my efforts are primarily focused in the advocacy for and efforts to advance the profession and community health and wellness, we realize that only about 20% of the population, when you're looking at the U.S. or even globally, are active in facility-based programs, and that physical education programs in schools are at an all-time low. So there's 80% of the population that we're not able to reach, and increasingly we don't have a culture of physical literacy and physical activity. Children that grow up in homes where their parents aren't physically active or have had negative experiences associated with physical education or sport, especially since it leans, at least in the U.S., towards elite participation, not mass participation. That we have to put ourselves in a position to provide them with the education, training, and tools that they can use either within their own family to adopt healthier, more active lifestyles, or that can be leveraged through community-based organizations and their volunteers. And inevitably, there will be somebody that is passionate about this that's willing to take that leadership role, but they may not traditionally have the expertise. So we're trying to fill that gap by providing those tools and resources.
Amazing. That's amazing. And so that starting point for them, ACE can be that starting point for them to be able to activate, whether it's at a community level or even a parental level, through your resources.
Sure. And you know what we're also hoping from that is that just the same as we made our passion, our career, that there'll be some people that are inspired to move in that direction in a way that allows us to diversify our workforce so it more closely resembles the communities that they serve.
That's amazing. That's very, very interesting. Very cool. And you have this deep understanding of population health and community health over the last number of decades. What's been your experience with activating communities and really making moving accessible to everyone?
Well, it's there's a lot of different elements of that are important, and it's interesting that you mentioned the public health and the population health because, quite frankly, they're more receptive to what we do. We're more in their wheelhouse than perhaps many still that are in the medical community, and of course you have to have places and infrastructure for people to be physically active, and that has to be located near where they are. But a place is a space with potential. You have to have the programs and the leadership in place so that it meets those SMART goals. It has to be time bound. It happens at a certain place at a certain time for a certain duration. And And if you make those programs available, and you're communicating that they're accessible and you want them to be free or no cost in many cases, or bring them into places like schools and workplaces where people of all ages spend the vast majority of their day, you can make that right choice, the easy choice for those individuals. And of course, you want those programs to be quality so that
Right.
they're safe and effective and reach those goals. But um, people people want to be invited to participate. It's tough to start moving. After you're moving, it's less difficult.
Absolutely. There's so much truth in that. And it really sounds like, you're speaking to the collaboration piece there,
Yes.
for leaders in all the fields, whether that's science, you mentioned healthcare, the sports fitness industry, education, policy making, to really work collaboratively together. Why is this more important than ever? And what does that look like for you?
Well, I think there's two things that I would highlight in terms of why it's important now. Coming out of the pandemic, we realized that individuals that had good health status, they were active, they had healthy weight, they didn't have high levels of inactivity um, related chronic disease, fared much better when when they had COVID than those that didn't. The the contrasts are stark and documented in the research now, and so we have this moment in time also where people realize that those things that they could kind of push down the road around taking responsibility or engaging around physical activity are more important, and they're looking for that leadership and expertise. What do I do? How do I participate? And then the other is that we have a physical inactivity crisis that is affecting public safety, and in the U.S. Military readiness. The number of individuals that are of age to serve in police, fire, military, that are fit enough to serve is at an all-time low, and of course they compete for attention and for those candidates. And we know also, to the point that you made, if people don't establish a culture of physical activity and movement as a child, the likelihood that it will happen in adulthood is far lower. So we're trying to work collaboratively with government and health advocacy organizations to address that. And we want to start in many cases with youth.
Yeah. That's amazing. And if I could just pull on that thread, Graham, with you, if anything is possible, right? If we take that mindset, what would your message be to those leaders, at the government level, and that can really, push the needle at a national level, perhaps? What would your message be if anything is possible?
Well, one of the first things that we have to do really is educate them. They have stereotypes and perceptions about who we are as professionals in our space, and what that physical education experience was in school, or that fitness facilities, regardless of whether they're for profit or community based, or country clubs for people that like to pick up heavy things. We need to do a better job of providing those outcome based programs that are scalable, accessible, affordable in communities, and that they can see a return on their investment. In the United States, when they score a bill that would invest in our space or any other, they want to look at what the cost and or savings will be over a 10-year period of time. But there are other measures that they can and should be looking at in terms of return on engagement as opposed to return on investment, and the quality life years that people have. What is the presenteeism and absenteeism of individuals that are active and healthy? What are the healthcare costs associated with them? And we know those are disparate. There's a several $1,000 difference annual expenditure for healthcare for individuals that are physically active versus those that are not.
Right, absolutely. It's to the point about your focus on youth and the preventative part and there's much in the literature around how, physical literacy contributes to the likelihood of people being more active later in life, even if they
Hmm.
disengage during teenage years. So there's a lot of good solid science there. And as you said, it's the education of these leaders then to hear and see the value and the economic return that's potentially massive
Sure.
in this case.
And at least here in the United States, it's a lot more likely that we can incorporate those programs into a before or after school than extend the school day and return physical education um, on that, or at least do that at scale. And we believe that it could open doors for a return to a more formal inclusion of physical activity in the school day.
Absolutely
That's where
agree.
organizations like yours do an amazing job by providing the curriculum.
Appreciate that. We're of the exact same belief, Graham, in terms of providing that before and after school piece to amazing instructors and programs that can really support this and support the communities at large, and kids for behavior change. So that's definitely part of our mission, and the healthcare piece which you talked to, that preventative piece feeds into that. And I know you're doing quite a bit on the role of the healthcare piece, and some of that maybe through your work in the Physical Activity Alliance.
Sure.
Would you mind speaking and highlighting that link, on the healthcare piece and their buy-in?
Sure. So at ACE, we believe in collaboration. We think that's the key to our cumulative success. You have to have critical mass before you can achieve results, and you can't just come into communities. You have to be humble. You have to come alongside, and you have to bring complementary resources and experiences. So the Physical Activity Alliance is Washington, D.C. based. It's a group of organizations that are cross sectoral. So you have um, academics, practitioners, government, health advocacy organizations, um, and industry all working together to promote physical activity in a very broad sense in Washington, D.C. And one of our really big projects at the moment is ensconced in a larger set. It's to bring standardized physical activity measures into the electronic health medical records. And that would really think of it as physical activity as a vital sign. So it's really based ultimately on the physical activity guidelines for Americans. How many minutes you accumulate and are you active on most days? And the goal with this is to make it a vital sign that physicians and other primary care practitioners track. And that'll, of course, be a really important benchmark in terms of data and our ability to collect and manage um, that information. But it also sets up the opportunity for a referral. In the United States, the U.S. Preventive Services Task Force recommends reimbursement for programs and interventions for individuals um, that are at risk for inactivity related chronic disease that have at least one additional risk factor. So if you're inactive or inadequately physically active, it provides an opportunity for that physician or referring professional to refer that individual to a facility, program, or professional that can provide that leadership, that expertise, and hopefully in those scalable programs that I mentioned, the one to many, so that they're broadly accessible. And so we're about a year and a half into that effort. At the end of May, we believe it'll be coming to a ballot for that standard, and then we continue to work on what does those referral criteria look like? What does the recipient um, look like in terms of that referral? And then how are we going to track and report back to the physicians and or payers? What were the outcomes of those interventions? So we're very, very excited about that work. And one of our other collaborations is with the Coalition for Registration of Exercise Professionals and the U.S. Registry of Exercise Professionals, which will we're building towards that being the recipient of those referrals, at least as it pertains to the practitioners, that group of qualified individuals. And then there's a data specification um, for connecting that data from that registry for that positive verification of credentials as well.
That is very cool. That is such a missing piece in the whole ecosystem and knitting it all together. That's a big body of work, and it sounds like you're making massive inroads into that.
Yeah, it's a fascinating process because none of us are technologists that are involved in this, but there's a very, very heavy piece of that, and it's we're learning something new about that process every day and the opportunities to, to make that go. Um, and in some ways, it's a little bit like public transportation. It has to go enough places to really be useful. So we're building those connections as we go along. But there's a lot of enthusiasm for it, and really, I think the Physical Activity Alliance and the U.S. reps are examples of when you get colleagues that will come together to collaborate that bring that critical mass experience and resources together. Um, the reason why the HL7 piece hasn't happened for physical activity measures to this point is that while physical activity is an important component of prevention or management of almost every disease condition, they didn't view it as their water to carry to actually advance this. They wanted that to come from the physical activity sector. And of course, then they're coming alongside and saying, we support this, we're excited about this work, and we want you to be successful.
Wow. And this is why your work matters so much, in that leadership space of moving this forward. It's phenomenal, really.
Well, and I'm sure that you've had the same experience when you're working as a physical education teacher or as an individual practitioner. We always have aspirational goals about how we want to be viewed and respected, compensated, and the realizing our full potential. And it's hard to do that from a practitioner level. We really had to step out of that along with many other colleagues to say we want this future to be better, and we want to be able to impact at scale. And that's where you see the creativity come from. One of our other partners is with Special Olympics, so working with individuals with intellectual disabilities, and it opens up a completely different set of doors. And like I said, we're so excited about what you do at Kuul because we've lost one of our primary before and after school physical activity program providers in the U.S. The funder of that is focusing their attention in other places. So
Well, I can say, Graham, it's you've touched on something so important. It's a privilege for Cool Play to be involved, and I speak for myself. It's a privilege to be involved, to be able to collaborate. As you said, there's beauty in the constraints in our industry and getting creative, and holding that collaborative piece, because it crosses so many sectors, and no one organization or one person is it's possible to fix. And it's beautiful when you have a rising tide lifts all boats, right? So
sure.
it's
Well,
beautiful.
and some of the key pieces I think that kind of play into this that when we look at what you do and what we encourage others to consider in our space is that physical activity has to be fun.
Yes.
Yet for a while we've been through this process of the idea of functional training, but they could just stop at the end in many cases.
That's brilliant. That could
Yeah,
be the
it's
slogan, I think.
we're interested in those more technical and complicated things. Most other people just find joy in movement.
Absolutely. And that's a philosophy of Cool Play. It's bringing the joy of movement and activity back to kids, and empowering them. It's the essence of it. Fundamentally, we all love to play, even as adults, though I don't know we admit it too much.
Well, I think we missed some of that, though. I'm not sure that we get the exposure. Before the pandemic, we were in Washington, D.C. for a President's Council
Okay.
on physical activity meeting, and they brought in a junior high school class. And at the meeting, we were all playing freeze tag, and all the adults were grinning, like children, because most of us probably hadn't played that game in some cases 35, 40 years, and we forgot how fun it is.
How about that?
And it really focuses you back to the ground is how can we get people moving, help them build their skills, but still make it enjoyable rather than a chore. Um, because it doesn't need to be a chore. Getting outside, I think, is a big part of that.
Absolutely. And hopefully post COVID it gives us that sense of when we were inside so much, the opportunity to be outside and to appreciate that and being in nature, it's a compounding effect.
Sure. Well, and one of our policy initiatives is really around the idea of shared use agreements, being able to use schoolyards and public parks and things for physical activity that's structured, and that became very, very important during COVID because it was one of the few risk mitigated environments that was available for professionally led physical activity. I think what we're seeing is that a lot of people don't want to go back inside,
Yeah.
and children going back to kids, they're indoors in school classrooms all day long. They're more than happy to get outside, even if it's for a quick physical activity break. And
It's
so
so true.
moving into environments that they prefer, I think, is also a key part of what we need to collectively do.
That's exactly what we're seeing as well, and you're right. It's something we should leverage. That behavior and the inclination and bias to move outside
Hmm.
and support. So absolutely, it's just vital for our overall well-being. I'm curious, Graham. You've talked an awful lot about all the different areas that you're working on, and the movement, trying to move the needle forward on a
Hmm.
situation that you spoke about, the physical inactivity crisis. I'm curious, how excited are you about the future? When it comes to activity and movement, is it all doom and gloom, or what are we looking at?
No, I think it's been extraordinarily difficult for a lot of people through the pandemic, and clearly when you look at some of the other sectors that are kind of adjacent, the bicycle industry had an absolute boom during the pandemic because it was one of the few things that people could go out and do. I'm encouraged that the evidence coming out of COVID shows that physically active individuals did better during that, and that resonated with people. I think we have to keep our focus on the quality of the practitioners, the programs that they're delivering. I think we need to do a better job of reaching communities that are under resourced. Um, in the U.S., those communities are the ones that are most affected by inactivity related chronic disease, and we have to diversify our workforce too. It has to look like and be from the communities that they're serving. Um, and the combination of health impact plus the economic impact that's possible on this, I think will take us forward. But we have to stay the course, and now is really the time to make progress. And for individuals that are working in the space, I think it's incumbent on each of us to put our best foot forward to address some of those persistent and pervasive stereotypes about what a physical activity teacher looks like, or where their focus and attention is, or their priorities, um, and and look for opportunities to volunteer. I know sometimes in schools it's complicated with background checks and everything else, but we do have to be visible and give back, and in some cases, quite frankly, behave like um, faith-based communities as opposed to businesses where it's not just about coming through the front door into a space for exercise, that we're active and engaged in the community and making those offerings available to connect with the community. That would, I think, um, positively impact the relationship and how things work. If God forbid we suffer another pandemic,
Yeah.
we didn't have the relationships in our sector with public health and government at the local and county levels to say, okay, how can we work together to mitigate risk but still give people the opportunity to be active? That engagement is critical.
Yeah. And her, what are the things that you would say to, or at a community level, those that value it, whether it's a healthcare organization, whether it's leaders, to if they're valuing this, where would they look to be able to put those relationships in place that you speak to be able to bolster and make movement accessible?
Well, there are a number of trade organizations, um, domestically and internationally, that are active in this work. In hospital-based wellness, you have the Medical Fitness Association. The Y and globally has always been very active in community and in the public policy and in advocacy. URSA is pivoting in terms of the things that they prioritize,
Okay.
where it really is more kind of aligned with what the things that you and I are talking about. And then Europe Active in in Europe is doing a very nice job with kind of engagement with government and advancing the sector in a comprehensive way to address areas of opportunity or concern. And then there's another effort that pretty much everybody's participating in when you look at those players, and that's the World Active Forum, which is has the World Health Organization kind of come alongside, where it's supporting the work, but not in not in a funding or an endorsing way. They're helping guide that, because physical activity wasn't a priority in and of itself um, within the World Health Organization until relatively recently. Physical activity was, but how it's delivered and by who, less so. So the World Active Forum is looking at the educational infrastructure and credentialing and ongoing training um, that is utilized around the world to prepare people for our spaces, the types of places they work, the types of programs that are available. And it's really more of a GAPA style effort, where to begin with, it's an inventory by country, and then we can identify those best practices and create those roadmaps from there, so that our sector is better prepared to come alongside public health and medicine and promote physical activity, sports participation, and other healthy behaviors, the lifestyle changes that are necessary to live our best lives.
Wow. Well, on that note, Graham, before we wrap up, when it comes to movement and activity, what would your wish be for today's young children?
Boy, really that they develop the physical literacy, so that they have the ability to engage in all types of outdoor and recreational activities that require strength, cardiovascular fitness, or flexibility, and that they have an opportunity to play not just a sport, but many sports,
Yes,
with a focus other than moving to the elite. It should be fun.
exactly. Exactly. Amen to that. Graham, it's been an absolute pleasure. I've really enjoyed this conversation.
Thank you
Uh,
so much for the opportunity, Claire.
Absolutely, it's been wonderful. Thank you for your time and your continued great work in leading in this space.
All
We're
right,
delighted.
thank you so much, and we'll look forward to seeing you and being in touch again soon.
Absolutely. Thank you very much, Graham.
All right, have a great day.